You're here with Dennis Ramundi and Phil Goldberg, my co-host. Phil is the author of American Veda. Our podcast, Spirit Matters. Our website, spiritmatterstalk.com. And our guest today on the show is Julie Carmen. Julie is very experienced and award-winning actress. She has been working in yoga for many years as well, and she specifically works very intently with actors and dancers and singers and people in the performing arts. And she has an association with Loyola Marymount College in Los Angeles and is also a clinical psychologist. Julie, thank you so very much for taking the time to come on the show with us today.
Thank you very much, Dennis and Phil. Nice to talk with you. Actually, a clinical psychologist has a PhD. I have a master's in clinical psychology and a license as a marriage and family therapist, so I don't want to sound like more than I am.
So we won't call you doctor.
Please. Please don't, I mean.
No, I know. I do. We call doctor falsely all the time. So, Julie, you have a really, really interesting background. You started out as an actress, and then you segued. At some point, you must have developed a passion for yoga and for healing because you became a certified yoga teacher and a marriage and family therapist, if I got that correct, and somehow ended up combining all these interests. Can you just give us a little bit about your background and the transition from acting to the healing and personal development world?
Yeah, it's when I look at it from the point of view of my personal odyssey, I started out being an artistic spirit born into a family that was incredibly supportive but had no ties in the entertainment business. I had a kind of magical great aunt who lived in Cuba and Dominican Republic, and she was an extraordinary pianist, and I'd sit next to her, and then a great aunt that lived with us for 11 years who was an actress and then became a nurse, as my grandmother did during World War II, labor delivery nurse. So it was in the template of the genogram that I was born into to make those transitions. And also, so I think that's kind of where it started. I can be more specific. When I was 13, 14, 15, I grew up in a town in New Jersey about 20 minutes from Greenwich Village, so during the 60s. So I hung out with Jimi Hendrix. My boyfriend played on his last recording, and we went up to his haunted house and stayed there for a few weeks while he was in London right before he died. So, then there was that. I hung out with Miles Davis because I was working as the assistant to a woman who promoted jazz concerts. I was around these people all the time when I was 14, 15, 16, and it kind of thrust me into anything can happen, magical thinking like teenagers dangerously get caught up in. And I thought, well, I can be an actress, and got pretty lucky really early.
And you did that for some time. You moved to L.A. You were in Hollywood. You have an impressive resume on the International Movie Database. And at some point, tell us about the segue into teaching yoga.
From the time Richard Hittleman's book came out, my brother and I were doing the postures. I went to Unitarian summer camp, and they had tantra drumming instead of, how to make archery,
Really?
Tantra drumming, and we did, moonlight, headstand practice and, organic gardening. So that was kind of cutting edge. The Unitarian movement in the 60s was very embracing and very about yoga. So I don't know the time when I wasn't doing yoga. I was studying traditional ballet with Fred Danieli at the Garden State Ballet School, in South Orange from the time I was in second grade, and then transitioned into Afro-Cuban with Sevilla Fort. And she is the first one, when I was about 13, 14, I was holding my leg trembling up in the air. She came over and in this huge, gorgeous Haitian voice, she said, "Breathe, dear." Mm-hmm. And I'll never forget that moment. It was cathartic.
Mm-hmm. Julie, I wanted to ask you along those lines of yoga and acting. First of all, where are you from in New Jersey? I'm from New Jersey.
Milburn.
Okay,
Milburn.
I was born in Jersey City and grew up in a town called North Bergen, just north of there. Small world.
Oh, I know it all well.
The same time.
Small world. Yeah.
So when you work with actors now, most actors, or maybe not entirely, but in large part, when they come to you for yoga, learning yoga postures, are they coming because they want to be better actors and they figure yoga is going to help them in some way, or they're looking for relaxation, or are they what I would call, or Phil might call, in our series covers contemporary spirituality, people seeking higher states of consciousness, some type of enlightenment, some type of greater fulfillment? What are the folks motivated by that come to you?
Primarily integration and balance in their lives. It's not that I publicize that I work with actors, but since 2001, 2002, I've been Suzanne Summers' private yoga teacher for the last 12, 13 years. Mm-hmm. So I'm at her house Monday, Wednesday, Friday, and she certainly doesn't need my help staying fit. She's the queen of fitness. But we met doing a movie of the week playing best friends, and it kind of segued. And then someone from Malibu Yoga said, you should study with this girl Julie, and then we recognized each other, and we've been very close ever since. So she's been very public about her struggles with cancer, and her house burned down the morning after a yoga class. That we both left, and her house burned down. So she's dealt with some harsh, acute stress issues. And then she also was very public about being the first woman in America to regrow her breast from her stem cells that they harvested from her own body after a lumpectomy. So she's very cutting edge. And she opened her one-woman show on Broadway right after having cancer surgery. So all of that, keeping her grounded, balanced, creative, productive, that's how I work with actors and yoga.
Is there for people who don't have the kind of holistic perspective that you just described, is there a sort of instrumental or operational value that they get from regular practice or from your training that translates into how they are on stage or on a movie set?
The main point that I would respond with is being present. That my synthesis between yoga and acting is about being present in the moment. Studying with Sanford Meisner, it was moment to moment, being wholly present. And then acting for John Cassavetes and Gloria, it was at a real developmental age when I was just starting acting. I had the luxury of working with John and Jenna for 4 weeks on Gloria, including 2 weeks of rehearsal. And it was all about being the ultimate of being present. And yoga helps me get there.
Right. Hey, Julie, let me follow up on that a little bit. I've never acted, but I've done a lot of public speaking. And if I give a good talk, or anybody gives a good talk, it's because they're right in that moment. Their mind isn't somewhere else. They're totally attentive to what's taking place at that time. And it sounds like that's what you're talking about. How does yoga do that? I mean, I've practiced meditation for many years. I've done some yoga, probably not enough. But how does yoga specifically get one in that moment that you're talking about?
Well, I go back to the second aphorism in Patanjali's Yoga Sutra, Chitta Vritti Nirodha, which is to restrain the rolling of the mind stuff. Mm-hmm. And then in the Hatha Yoga Pradipika, there's a kind of how to get there. and it's step by step. There's not much about asana, but there's certainly a lot within the Patanjali's Yoga Sutra specifically on how to be present in the moment, be here now, as Ram Dass would say. So to restrain the rolling of the mind stuff, or to transcend the rolling of the mind stuff, for me also includes processing it, which is where psychotherapy comes in. One's personal self-reflection to clear out any residue and process life's ups and downs so that we're not distracted by angst or anxiety.
And so this figures into your regular teaching. You obviously don't only teach postures and alignment. You're also working with breath, meditation presumably, and the other limbs of Patanjali, correct?
Well, for 12 years, I taught Center for Sacred Movement. From the day and Saul David Ray opened the studio, I was there from the beginning, and because I had just subbed for Max when he was in India for 6 weeks. So it was all, and that point, the idea of opening a Center for Sacred Movement in the heart of Venice, California, was very radical at that time because it was very different than...
When was that, Julie?
That was in 2001. Mm-hmm. And then Exhale bought it, I think, in 2003. And I stayed with them for 12 years. And I was teaching, I always liked teaching the community class, which is half price, and I always loved teaching level 1 because I like to think of it like a big fishing net, pulling in people from all walks of life and how to help them embrace yoga that is specifically related to them. I also like to teach at 1 o'clock because, people don't have lunch yet, because it is a tiny class. And since I was leaving Hollywood at that point, I really didn't want to be a famous rock star yoga teacher. I wanted to connect one-on-one with people and really observe what their psyche is saying to me through their movement patterns and breath patterns. Mm. So that was my fascination. And I always incorporate words like aparigraha, excuse my Sanskrit pronunciation, but, greed, not going beyond where you need to be at that moment. And so being too heated, pushing too hard, overindulging in chaturanga so you have a rotator cuff issue, all of those things come in and are informed by the Yoga Sutra.
Right. For those just tuning in and listening there, in listener land, you're listening to Dennis Ramundi and my co-host, Phil Goldberg, author of American Veda. Our guest today, yoga teacher Julie Carmen. Please, if you have an opportunity, go to our website, spiritmatterstalk.com. It's free to subscribe. Julie, I wanted to ask you, you work with a lot of young people, actors. I watched a couple of videotapes on YouTube of you speaking to the actors that were taking your classes, and they were really attentive, and they were focused very deeply on what you were saying, and it looked very willing to follow your advice. What kind of feedback do you get from these young people after they've been practicing yoga with you for a few months?
Well, you're speaking about the Loyola Marymount Yoga Therapy RX. Loyola Marymount Los Angeles has a master's degree program called Yoga Studies, and I teach in their graduate department and the undergraduate through Larry Payne's program called Yoga Therapy RX. It's a 4-year certificate program for yoga teachers who want to go further and become certified yoga therapists. And the first year, it's all about musculoskeletal system. The second year, the respiratory system and the digestive system and the endocrine system and the cardiovascular system and mental health. And I teach assessment and treatment planning, Western psychology specifically, so yoga therapists can interact with clinicians about any mental health issues that students come in with. And since I'm one of the trailblazers in that particular blend, I think it blows their mind just to realize that there are ways, and there's a huge range of future projects I hope people jump into and do research on about how Western psychology is affected and seen through a different lens when you're a trained yoga therapist. So the young people and also middle-aged people are in the class. They are really wide-eyed about it and writing down all kinds of ideas. And I have no, I don't own the information. I just want them to continue studying it and start researching it and start writing about it and journaling and creating more literature on it. I want the field to go further. So I feel more like a parent figure feeding them ideas that they can then use as a springboard.
Mm-hmm.
Julie, we should mention that your website, yogatalks.com, is something our listeners should visit, and you have a couple of DVDs there that they may be interested in. I want to explore this interesting combination of having credentials as a therapist and as a long-time yoga teacher. You alluded to seeing mental health issues or psychology differently from a yogic perspective. Could you elaborate on that, on the sort of integration of this Eastern and Western disciplines?
In a few short words.
Take a few minutes.
Okay. There's a wellness model and there's an illness model, and there's some Western doctors, of course not all, focus on pathology. How can we rule out the big bad stuff? And after that, it's called lifestyle changes. Well, that lifestyle changes is a big umbrella, and that's a way that yoga therapy can start helping the big picture. For instance, somebody goes to a gastroenterologist, finds out that they have a marker for Crohn's, but they don't have Crohn's, and they don't have a parasite, and they rule out all the big bad things. And then they say, okay, what do you eat? When do you eat? How much do you eat? Do you walk? Do you stretch? Do you, do forward bends? Are you overweight? Are you underweight? All of those issues are dealt with in the Hatha Yoga Pradipika and in classical yoga training.
And the other question in regard to that, in terms of using it with your therapy, do you get folks that have substance abuse problems, alcohol problems, drug problems, and as a therapist, do you find yoga therapy to be significantly more effective than many of the other types of therapy that are being used to help those people with substance abuse problems?
Well, substance abuse problems are complex. From 2001 to 2003, when a place called Passages opened, a drug and alcohol rehab center in Los Angeles, I was brought in from the day they opened as the drama therapist and yoga teacher. I wasn't yet certified as a yoga therapist. And there, our medical director, who sat in on some of my classes with the the clients there, he said, this could really work. He's a psychiatrist, and he said if people did short bouts of the meditation and yoga breathing that you're giving them 5 or 6 times a day, to do it throughout the day, because during detox and the first weeks of rehab, you really need more intervention, more frequent intervention, not long stretches of it, but frequent. So in that way, it helps with the immediate detox and rehab, pranayama, and just tuning in, not an exaggerated pranayama, but just tuning into breath and heart rate, the vital signs, and being able to tolerate experiencing the body, because there's so much comorbidity between abuse, issues of trauma, and drug and alcohol addiction when it's at that peak level. I also, for 4 years, was the yoga therapist at Montenegro Eating Disorder Center, where a lot of the women also had a difficult time tolerating being present in their body. So they would dissociate, and that's how their bodies could just over exercise, and they wouldn't have the brakes to put on.
Fascinating. When you decided to segue from your acting career, was the first step teaching yoga, or was the first step the marriage and family counseling?
The first step was teaching yoga. It was a long, drawn-out decision because I had 2 little children, and right at the peak of my acting career, I was spending 2 months in Australia and 2 months in Mexico and 2 months in Vancouver and 2 months in Tucson, and it was in Madrid, and dragging one or both children with me, and then not being with them once we got there because I'd be on the set in a very, very high intensity profession. So I started noticing the results of that on their health and well-being and sense of stability, predictability, and reliable mommy. So I said either I retire or I'm going to run away from home. So I retired, and since I've come back into acting just now that they're out of the house. I have a couple new movies, but that's just for fun. I mean, I'm not really pursuing it hard. It's always been my first love.
Right.
So your question was which came first?
Yeah.
The acting, the yoga, I would go to 5 days a week to a level 2-3 class, and in Shavasana I would cry quietly, but I would cry, and it felt like I was really shedding the performer.
Mm.
And it took a few years, and that's Max Strom's class actually helped with that because it gave me a very safe container where nobody bothered me, and I was able to just go through that letting go. And so it felt like a 360-degree change.
Mm-hmm.
And then when I was at Passages and everybody had letters after their name, big degrees, but I had insight, I said, gee, I really should go back to school. So I went to graduate school and got my master's in clinical psych.
Julie, how have you integrated yoga practice into your own life, and are the people that you're closest with in your life also involved with yoga? But what's your daily routine like?
I swim about, I'd say about 8 hours a week. I love the water.
Mm-hmm.
And I think I'm Pitta. I'm from New York originally, mm-hmm. and I'm an Aries. So I need something cooling like that, but I don't like a very yin practice for my body type. So swimming I've always done meditative swimming. At one point I would do 100 laps a day and count them, and it was very, very meditative to keep that left brain, right brain working at the same time. Mm-hmm. And my daily practice is I meditate, very short meditation when I first get up. I find it's important for me to not go on the computer, and I manage my computer time so that I'm not slave to it. And the iPhones are really taking over people's lives, I
right.
think. And then with food, I have, I consider food very integrated with my yoga practice. I don't want to eat for 2 hours before. I love pranayama. If I had to skip something, I would probably skip asana because I had some old repetitive use injuries from my dancing years. Mm-hmm. So I teach a practice where I can demonstrate, because again, when I teach level 1 in a big place, a lot of people don't have the proprioception, and they need to see someone demonstrating. I know classically there would always be a third person demonstrating, but that's not how we were trained. But I really prefer teaching one-on-one. But that's pricey. It's cost the same as a psychotherapy session.
Yeah.
But I work with a woman with both Parkinson's and MS. And I work with someone with massive scoliosis, kyphosis, and Graves' disease. I mean, there's some complicated issues, and I can only work with those people one-on-one.
And yoga, we had John Kepner on a couple of months ago before the yoga therapy conference. And so I want to refer listeners to his interview if they want to know more about yoga therapy. I'm curious about what you've observed in the last decade and a half or so that you've been actively teaching and teaching teachers of yoga. There's a lot has happened even in a few short years. I can tell you what's happened in the last 200 years because of my book, or even since the 60s. But a lot has changed in the last 15 years or so, and some of it is of concern to people who are dedicated to this tradition. What are your observations? How do you see things changing?
I see that New York and Los Angeles and now other major cities have become meccas of yoga. There was one point where someone told me, it's all oral, passed on oral tradition here, but someone mentioned there are more people practicing yoga west of the 405 in Los Angeles than in all of India nowadays. So who knows who counted?
Yeah, right. That's a little exaggeration.
So at that point, the school where I was teaching realized that there were so many yoga classes being taught that they could no longer really compete in such a big space just having yoga students come in. So they started these teachers' trainings. And they maybe get 10 or 12 massive teachers' trainings each year. And in each of those classes, there would be some up to 80 or 100 students who then got certified by everyone from Shiva Ray, Eric Schiffman, Micheline Berry, Hala Khoury. All of those people taught at Exhale Center for Sacred Movement over the last 12 years that I've been there. So just think how many yoga teachers that's producing.
Right.
And then those yoga teachers would be minimally trained with maybe a 200 or hopefully now 300-hour course when it takes a lifetime. It takes a long time to mature as a yoga teacher to make sure that nobody's getting injured.
Right.
So,
Julie, I wanted to ask for people listening in to this podcast and thinking, I feel inspired now. I've always been thinking about doing yoga. What would you encourage them, and why would you encourage them to integrate yoga into their daily life? And where do they go to start? Where's a good starting point? Where can they get information about where to study yoga?
Okay, well, yoga is not about flexibility. A lot of people are intimidated because they think it's about getting into these pretzel positions, but it's really about unwinding the pretzel knots in one's head and heart and becoming more free and connected to a higher power, if you want to see it in that light. So where to start? Sometimes people who are a little shy or have some social phobia about going into a group class where everybody is flexible. Sometimes it's good to get a DVD, which is why I made the first DVD called Yoga Slow Flow. I made it in maybe because when Suzanne Summers' third or fourth book that included a chapter on me came out, I got so many letters and emails of how do I do the practice that you're teaching to Suzanne. So I did my first DVD. It's called Yoga Slow Flow, and there I demonstrate, a dozen of the major essential central postures and talk a little bit about alignment and breath. It's a 20-minute practice that people can do with 3 different voiceovers. One is very literal, inhale, raise your arms, exhale, contract. And the other is, once they get those movements, the other is more inspirational. And then there's a music only, Shanti Shivani. I bought some music from her, and it's divine. So that's a 20-minute practice that people can put on, and it's not intimidating. And then once they get those basic postures, they'll feel brave enough to be able to know they can hold their own and go to any class anywhere that they find in their local community. The closer to the home, the more apt someone is to go.
Mm-hmm.
And just, never push yourself. And if someone has a pre-existing injury, I take what their physical therapist says and find the corresponding yoga postures that work at the same area.
Great advice.
Do we have time, Dennis?
Yeah, one more question. Yeah.
There's a lot of concern, and you alluded to it, about the level of expertise that a lot of yoga teachers have. That there may be teachers being certified with minimal training. How does somebody does that matter to a beginner entering the world of yoga? And are there ways to find the more better trained and experienced teachers?
Well, I have two answers. One is that there are always exceptions to the rule. There are brilliant children who outthink, 70-year-olds, and there are beginner teachers who are just intuitively more present and observant and caretaking than people who've been teaching in 20 years who are more burned out sometimes. So, there are two ways to look at it.
Yeah.
I do see that because of the business model I explained before, that many people are jumping into the teaching world undertrained, but they need to start somewhere. If someone feels that their teacher is not right for them, then just say, who are your teachers, or which teachers do you like, or try it. It's a really a matter of experimenting around, trying different teachers, but always being your inner guide and never pushing beyond parigraha, that non-greed in one's practice.
Julie, thank you so very much. You're listening to Spirit Matters, where we discuss contemporary spirituality issues of contemporary spirituality. My name is Dennis Mundy, my co-host Phil Goldberg, his book, American Veda, and our guest today, Julie Carmen, who is a yoga teacher. She also is an award-winning actress and a therapist. We really appreciate the time for coming on today, Julie. And can you tell our listeners your website once again?
Sure. Thank you, Dennis and Phil. And my website is yogatalks.com.
Thank you so very much. Till next time, Phil.
Okay, thank you, Julie. It's great to talk with you. And having met your two children, I think you made a very good choice in giving them more time.
Great. Thank you so much. Thanks. Okay.